You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, board-certified periodontist, Dr. Jean Salcetti. Dr. Salcetti, welcome to the program.
Hi, Randy. It's great to be back.
Now, we've had you on the program before, and as always, you look good. You brought some new photos.
I do. I have some wonderful new patients.
And some are very graphic. So we'll save that for last. Probably the most graphic photo we've ever had on the show.
Wow.
So, but there is good news about it.
Great.
So, when dental implants came along, how did that change your life, your career?
Well, my career has always been involved in dental implants. When I did my training as a specialist back in the 80s, we had the opportunity to learn dental implants. And that's what separates me as a dentist, because I have surgical training. I have 3 years of advanced beyond dental school training in the surgical placement of dental implants. And that's what separates us as surgical specialists versus the general dentist. But how it's transformed my practice is that it allows me to be able to take the tooth out, and during that same appointment, that same day, I can put a dental implant immediately into that area.
What about pain? It seems very painful, by the way. Do they complain about it?
Dental implants are not so painful in and of themselves. They go down inside the bone. The bone itself has no nerve endings inside the bone where the dental implant goes. And so, to be honest with you, that's not a complaint that I hear very often at all.
But that keeps people from getting it done.
Well, it's one of the misconceptions.
Oh, really?
It's one of the misconceptions in implant dentistry, is that there's a lot of pain involved and a lot of swelling and a lot of discomfort. And the reality is, you talk to any one of my patients, they just go, oh, why didn't I do this sooner?
Do they really say that?
They really do. Then they tell their friends that the whole concept of dental implants was easier than they thought. It didn't have the pain that they perceived that it was going to have, and they regret that they waited so long to be able to get their teeth fixed or to get that implant put in.
Okay, good. Well, you say you're changing people's lives. Let's take a look at some of these photos.
So this is my very, very dear patient, Barbara. And Barbara presents to me in her early 80s. And she had unfortunately just recently lost her husband. And she had been living with a smile that she really didn't like. She was very uncomfortable.
What's going on there, by the way? I mean, her bottom teeth.
God, Randy, she's got a denture. Well, she's got a denture on the top. That was really her first concern, is because the denture was
looks pretty good, though.
Well, but it looks like a denture. I mean, it's very kind of flat planed. It kept falling out. It was loose. She didn't like the way it didn't support her lip, and she hated her upper denture. When we look at the bottom, you can see that there's a number of things going on. She unfortunately, in dealing with her husband's illness, she never had the opportunity to go seek out dental care. And so if you look at the unfortunate deterioration of her teeth and her gums, you can see that there's been some infection, there's been some decay, and there's been quite a bit of ongoing disease that has been going on in Barbara's mouth.
So those teeth had to go? Couldn't save those teeth?
No, you know what? We were able to save those teeth. What we did is we put her through some periodontal therapy, we cleaned up the gums, we removed the debris off the teeth, and she was able to get every single one of her existing teeth crowned. As well as she was missing some back teeth, and we were able to place some dental implants in the back to be able to give her a full complement of teeth on the bottom against some dental implants that we placed on the top. We placed 6 dental implants with a brand new denture that actually just snaps in and is very, very strong. And she just loves her smile. If you take a look, Randy, look at her smile. Look at that face.
Very nice,
I mean, here's a vibrant woman who, is just engaging with, her friends and her family. And when you see this new smile, she just
looks younger.
She does look younger.
She also looks healthier.
You know what? She does. And the thing about the health of the mouth is that we know with the role that periodontal disease can play in overall systemic disease, Barbara puts herself at risk, as any patient would.
Is that an infection? I mean, is it considered an infection?
It is. It's a very, very, very aggressive infection. It's an infection that those bacteria set up this inflammation that gets into your bloodstream. And I'm sure you've read or you've seen or heard about the association between gum disease and heart disease. It's just very advanced.
So that could be taken care of. And
it can be taken care of.
So a woman like this, just put it off.
Well, they put it off for a variety of reasons. One, possibly dealing with the illness of a loved one. Secondly, fear of going to the dentist, fear of being ashamed that they've let their mouth get to this state.
Is it true they don't even want to show you their mouth?
Oh, I hear all the time, this is probably the worst that you've ever seen it, isn't
really?
it, Doc? I'm like, no, this is really pretty good. We can save your teeth, we can improve the health of the gums, we can put a dental implant or 2 in and get you your smile back. And that is everything to a patient.
Okay, now eating as far as with these dental, very strong?
Oh gosh, very strong. I mean, she loves biting into apples and corn on the cob and be able to chew a good steak and be able to really be.
Do they tell you that? Do they tell you that?
Every day.
Okay.
Every day. It's just wonderful. It's really what creates my passion for what I can give to the patients, because they get to walk out with this gorgeous smile. They're feeling younger, they're feeling more alive, they're feeling like they can go out and enjoy life to its fullest.
So no more dentures. I mean, the future of dentistry, I guess it's happening right now. Denture wearers don't have to be in that situation.
No, denture wearers don't have to deal with loose dentures and feeling that they can't leave their house or go out to a restaurant and go shopping for fear that their denture is going to, you know, be knocked loose if they were to talk or smile.
I had a dentist on my show a couple of weeks ago and had me put the glue on my hands. Have you ever had it on your hands? You can't get it off.
Do you know what? I can't even get it off some of these patients' palates when I'm trying to do some surgical procedure. I mean, it takes sandpaper to try to remove.
It really is
adhesive.
interesting, yeah.
And it's thick and it has a bad taste, and patients hate adhesive. So, you know, the first thing to go when you're dealing with dental implants is the adhesives.
So that's good. Okay, so what are we looking at there?
Oh, this wonderful, wonderful
nice.
lady. And with Helen, you can just again see this significant state of deterioration. She came with hating her smile. Her smile looked like she had a picket fence of a variety of different teeth.
Do they get emotional? I mean, do they, in front of you, they say, oh, doctor, I just, you know.
Oh, Randy, they get to the point where they start crying.
Really?
They're
Okay.
crying. They're really visibly upset because, one, they're ashamed that their mouth has gotten to this state of deterioration. Secondly, that they just want to feel better. They want to feel better about themselves, and everyone knows that it starts with a smile. When you meet somebody, it's the smile that, you know, is their first
Well, you're a
impression.
dentist. Of course you think the smile, though.
Well, you know what? I'm an eye person, but that's because I look at teeth every day.
All right, okay.
But truly, when anybody meets anybody on the street, your first impression of that person is when they talk and when they smile, and to be able to...
Okay, so with her, those two discolored teeth, was that bridge work, or what was going on with her?
Yeah, she just had individual crowns. So she's got natural teeth on the side, and then she's got crowns on the front, and then she's got some bridges in the back. And unfortunately, these were teeth that were not in a state that we could save, and so,
Okay, so they had to go.
we had to remove those teeth.
So usually the general dentist diagnoses and says, your teeth have to go, then you end up with them.
Right. So the general dentist would refer the patient to me, and I would do a very comprehensive evaluation looking at, can some teeth be saved? Is it best for the patient to lose the remaining of their teeth to be able to come back with a beautiful new healthy...
Are there certain people that self-diagnose? My mother, 73 years old, says, I'm too old. And I've told you this before.
You have. And I will tell you, unfortunately, there are many general dentists who say to the patients, you're not a candidate for dental implants.
Really? Okay.
It's unfortunate. And there's a knowledge base and learning that needs to exist to help educate our patients that any patient is a candidate for dental implants. I mean, you have to be healthy. You can't have...
I mean, as long as you're not in the middle of a cancer treatment or things like that.
That's exactly right. And the bottom line is that you have to have bone.
You don't sound like a dentist, by the way. You don't look like a dentist. Do people say that to you?
You know what? I get that a lot. People are shocked that when I come in to meet them that I'm the dentist. They find it hard to believe that I have the experience, that I have the training, that I have the degrees that I do to be able to provide.
You always knew you wanted to be a dentist?
You know, I grew up with a father who was a practicing dentist for 49 years. And so I started out as a chairside dental assistant.
It's like you've always been a dentist.
I've always been in dentistry. It's been, oh my gosh, you know, 30 plus years that I've been involved in dentistry. So I love dentistry.
So you fixed that woman's mouth. What did you do for her?
Well, look at this. I mean, if you look at her after photo, she's got these beautiful...
She makes you want to smile. You look at her.
Look at the difference in her smile. She's youthful. She loves to smile. She's vibrant. She and her husband travel all over the place. And now she can smile and meet new people with great confidence.
So what does she say? I mean, when it's all done, is this one of those things? I mean, you said it earlier that they said I should have done this years ago.
Well, you know, Helen was one of these individuals where she was transitioning from going from her own teeth to having a denture. So she was very concerned about what the feel of the denture was going to be like. Would she be able to taste her food? Would she be able to feel the texture of her food? So now we've got this denture that she absolutely loves. It's a beautiful denture. Her teeth
it snaps in, snaps out?
Snaps in, so it's very, very retentive. She's able to clean underneath the denture around the dental implants, and she's able to chew her food and not fear that, you know, it's going to hurt, because she had teeth that there was a lot of pain associated with the infection that she had around that. So now her teeth don't hurt.
So when you remove the teeth, the gums get better?
Well,
and why is that? Why is that?
Because the tooth is an infected tooth is very toxic. It's a toxic tooth that's creating this infection around the gums. So what do the gums do? They melt away. They deteriorate. It's like touching a hot stove. The first reaction is to pull back. Well, the gums and the bone will melt away off the root of the tooth for the exact same reason.